Hello families, welcome back to my YouTube channel. Today's video is about the facts and some misconceptions and importance of family planning. So kindly watch today's video to the end. I'm Janet Osua, your community happiness papa, and this channel is about health education for kids and adults. Thanks so much for stopping by, and thanks to all my returning subscribers. Kindly subscribe to this channel if you are new here and hit the notification bell so anytime I upload a video, you'll be the first to get it. Also like, share, comment down below at the comment section. On my previous video, I talked about the male sterilization of vasectomy. So we'll leave the link down below at the description box so you can go check it out. So let's dive into today's video. Don't go anywhere. When we talk about family planning, what is it? And if you have any idea about it, you can share with me in the comments section. So when we talk about family planning, it's a method or services that allows individual to achieve desired birth spacing and family size and contribute to improved health outcome for infants, children, women, and families. Or when we talk about family planning is the ability of individual, partners, or couple to anticipate and attain their desired number of children, the spacing and timing their birth. So let's look at some importance of this family planning. There are lots of importance about family planning, being it to the child, to the mother, to the family, and the nation as a whole. So we first look at the importance or benefits of family planning to the mother. So one, every pregnancy and childbirth carries a risk of death. So the fewer number of pregnancies, the fewer times she is exposed to death. Family planning also helps women with 4 or more children who has greater risk of death after childbirth from bleeding and other not to get pregnant. Third, it helps women to protect themselves from an unwanted pregnancy and then unsafe abortions. Fourth, it also helps women's body to recover physically and emotionally before the next pregnancy. Fifth, it also helps prevent women from having children too close so she can have time for herself and gets pregnant when she wants to. Health and quality of life benefits reduce the risk of maternal mortality. So family planning helps reduce the risk of maternal associated with childbirth. And then methods like condom, the male and the female condoms also helps to protect users from STIs. So these are the benefits of family planning to the mother. Let's see the benefits of this family planning to the child as well. Family planning helps prevent the risk of malnutrition as a result of premature weaning. If your baby is like 6 months and you get pregnant again, even the breast milk that the baby needs till the 2 years maximum, your child wouldn't even get. And then most of the time, if most of the people, when they get pregnant, immediately they get pregnant, they don't even care about the years of the baby or the months. They just stop the breastfeeding. But even if you get pregnant, you can still give breast milk to your child until you feel uncomfortable, then you can stop it, especially with kids that are not up to even 1 year. And then another benefit of this family planning to the child is that the risk of an infant and child death is less when children are born at least 2 years apart. As I said earlier on, after every pregnancy, you are to wait for at least 2 years before you go in for another pregnancy. And then the child gets more attention and care from mother, which results in good emotional development. Health prevents birth defects, which may result from older women. Yeah, so birth defects like Down syndrome and a whole lot. If you are too old and you get pregnant too, sometimes you see this Down syndrome stuff and all that. So these are the benefits of family planning for the child. Let's see the benefits of this family planning or importance to the family. Both the man and the woman have more relaxed sexual relation without fear of pregnancy. And then it helps couple to postpone having children to improve themselves educationally and then economically. Then families have more time for themselves and their children. Then it also helps couples or partners to save more or enough money to provide food for food, clothing, housing, education, and others for their children. It also helps family to save towards their retirement. And then let's see the benefits of this family planning to the nation as a whole. Outbreak of diseases due to overcrowding will be decreased. And then environmental pollution will be also reduced. Then population growth is also controlled. One of the major benefits of this family planning is the management of infertility. So kindly take note of this. Family planning does not cause infertility, but it rather helps to manage infertility. Family planning services do not only assist couples to plan and achieve their reproductive goals, but they also assist infertile couple to become fruitful. So, the couple or partners who wants to be managed of infertility should visit the health facility or the hospital together so that both will be investigated and then treated. So let's talk about some misconceptions about this family planning. I've made it known today that family planning do not cause infertility, but a lot of people say that when you go in for family planning, you can't give birth, you can't have kids, whatever. But I am here to clear those misconceptions about all that. When you do family planning, that doesn't mean you can't give birth. Some of the methods may delay in returns of fertility, but it all depends on individual. For instance, I got pregnant the month after I stopped my method, and then a lot of people also get pregnant after 3 months and even a year. So it's just an individual difference. It's everyone and how the drug reacts on each person. So, for instance, I got pregnant right after stopping. Somebody too got pregnant after 3 months. Others to 1 year. So that is how it works. But it doesn't mean that if you do family planning, especially those that they are not having any kids, they say when you do family planning, you can't get pregnant, you can't give birth. It is never true. It is better to have the family planning on than to get pregnant and go in for abortion and then you will lose a whole lot of stuff. So I would say that the family planning methods are best and it is good to do than to have an unprotected sex and then get pregnant, of which you are not ready for, then you go and do abortion. And then most of the time, this abortion stuff, they won't even go to the hospital and do. You even sit in your house, take whatever concussions, and then you'll be bleeding and a whole lot. So it is better to be on family planning if you are not ready for pregnancy. So let's see the second point about this misconception. So another point is the amenorrhea, and then amenorrhea is the absence of menses. And then a lot of people also say that with the absence of the menses, one can get fibroid. Please, it is not true. Changes in menstrual bleeding, like the spotting or the absence of the menses, it's a disadvantages of the side effects of this family planning. But it doesn't mean that if your menses is not coming, it will turn up and then you'll be having fibroid and all that. Please, it is not true. Sometimes you will even spot or you bleed, and it's all normal. But in a situation where you bleed like 2 or more weeks, then you have to report back to the facility, and then you'll be given medication to stop the bleeding. But some people doesn't know about this, and then they can be bleeding for a month and stuff, and then they will still be bleeding, and then they will be talking ill about this family planning. Please, if you have your family planning on or it's done and you bleed for more than 2 weeks, please do not in the comforts of your house. Kindly report immediately to the hospital or the facility. Even if where you did it is not close to you, you can go to any nearby facility that they do family planning, and then you'll be given medication to stop the bleeding. You don't have to be bleeding for. And then some people too will say that maybe when you started the family planning, their menses wasn't coming. So when it starts to come for a month, they will just allow it. Please no. If your menses is not coming, it's the medicine that is causing that. So when it starts to come, the maximum number is 7 days. So anything more, just report, and then you'll be attended to. And then the moment we have this family planning on, and we have leg pain, waist pain, what a lot of stuff. Even some people when they are walking and they sleep, whatever they say is family planning. Please, the only thing family planning does is to prevent pregnancy. So if you are there and you've not even done family planning, once a while you feel headache, once a while you feel stomach ache and all that. So once you have family planning on, it doesn't mean that your legs can't pain you, your waist can't pain you, your stomach cannot pain you. A whole lot of things can happen. But the moment we do this family planning stuff and we see all this, then we'll be associating with the family planning. So please, it's all there. It's part of this misconception stuff that I'm talking about. So if you are on family planning and then you have other sickness, please report to the hospital, see a doctor for treatment. Please don't associate it with this family planning, because it is not the family planning. Note that all the family planning has its side effects, of which I have stated all in each of these family planning videos. So any method you would like to go in for, kindly watch the video on that, and then you make your decisions. So kindly let me know in the comment section if um lab and other stuffs are done in other countries before we do this family planning. And here in Ghana, we do not do any lab tests or whatever before we do it. So the moment you try a method and it doesn't work for you, you go in for another method. So we do the try and error, and definitely you get a method that will work for you. Even if all the methods that I have mentioned, being it long or short, didn't help you, you can go in for the natural method. Of course, it also works. If only you can discipline yourself, and the days that you are not safe, you wouldn't have sex, or you use a backup method like the condom. This is the end of today's video. Kindly give this video a thumbs up if it is useful. On my next video, we'll talk about family planning matters in our local language. So kindly subscribe to this channel and hit the notification bell, so anytime I upload a video, you'll be the first to get it. Also like, share, comment down below at the comment section. Thanks so much for watching today's video. Bye guys.